Are you the nurse for Mrs. Pack in room 666?
Yeah, I am. I'm Joy.
Alright, nice to meet you. We're going to start her discharge for her.
Okay.
Here's her medical history. She just had a cesarean section last week, so there's still pain and discomfort there. So we have to make sure, especially when she's sleeping, so make sure that she takes it easy. She's in the hospital now because she had a craniotomy 2 days ago. She's post-op for that. We're getting ready to send her home. We removed a benign tumor from the lateral right side of her brain that was causing her headaches and seizures.
Okay.
She has moderate drainage from her incision site on her head. Her level of consciousness is improving more. She knows she's oriented ×4, and her pain level has gone down from 9 to 5 since surgery, but we're still giving her pain meds to control that. Here's some instructions for her when she goes home. She's on Keppra via IV now, so let's put her on the tablets for 2 days to prevent any seizures, keep them at bay.
Okay.
She has clindamycin to prevent wound infection, and the Vicodin is for the pain, so make sure she knows how long she can take those.
Okay.
She's also deficient in iron, so I'm prescribing iron dextron that she will inject at home daily. Make sure that she knows how to use the Z-Pack method for that, the Z-Track. I want her to change the dressing twice a day, and if she sees any signs of wound infection, to come to the office immediately.
Okay. How often do you want her to change your dressing?
Twice a week. And I also want her to avoid strenuous physical activity, no lifting. If she's feeling some discomfort while laying down from the C-section, put a pillow behind her back. It helps the discomfort. And then let her know she cannot drive for 6 months because of seizure precautions.
Okay.
Any questions?
Yeah, since she just had a C-section a week ago, are there any special instructions for her concerning that?
Oh, thanks for reminding me. When she's holding her baby, make sure she's sitting down in case she has a seizure and to decrease the amount of stress on her body.
Okay. Okay, so I'm just going to repeat the instructions back to you, make sure I understood you. Good morning, Trang. I'm Joy. I'll be your nurse today. Good news, you're being discharged. I have some instructions from your doctor. I'm sorry, do you guys speak any English? Alright, 1 second. Here is an interpretation chart. Can you point to the language that you speak? Oh, Chinese. Alright. Well, give me 1 second. Let's get an interpreter over here.
Hi, I'm Mrs. Teriyaki, and be your interpreter that you requested.
Hi, I'm Joy. Nice to meet you.
Nice to meet you too. So what would you like me to do for you today?
Well, I have a few discharge instructors for the patient here. I wrote down all the instructions for you already.
Okay.
I see that previous nurses have already covered some of her discharge instructions, which is good. So right now we're just going to go over it again and make sure that her and her mom understand.
Okay, sure. 你好，你係咩名啊？
True.
你好，你係咪佢阿媽？係。你好。Thank you. Okay, no problem. So, while you're demonstrating, I'll explain to Trang what you're doing so she can perform it at home, okay?
Okay.
Alrighty. Okay, so I'm just going to explain to her these instructions. Let's see. You 知唔知我好唔中意你㗎？我唔中意呢個女仔，同埋我唔中意佢㗎，係咪？係。我又唔中意同你哋講嘢，我唔想嚟呢度，我要返屋企，咁我又要嚟呢度，咁我又唔想嘅。So 你知唔知㗎？係。Okay, so it says here that you have a dressing change that you want her to perform while she's at home too?
Yep.
Okay, so while you're doing that on her, I'll just explain to Trang and her mom what you're doing. Okay? Good.
Alright, Trang, now I'm going to show you and your mom how to change your dressing.
佢而家講俾你聽點樣可以擺低呢個嘢喺你嘅頭度啊？係。
Alright, now you see how it's tucked here? Untuck it slowly.
你要擺低呢個嘢，咁你先可以除嘅。係。
Now unwrap it while you check for drainage Make sure it's not too bloody.
慢慢拎呢個嘢出嚟，有時會好多血出嚟，所以要慢慢做㗎。
Alright, now when you get to the actual wound, it's going to look a little red.
你一除咁，你會睇到啲紅啊，啲好多血出嚟嘅會有。
But that's fine as long as it's not swollen or oozing.
完全唔緊要嘅，係咁噶啦。
Now when you're done unwrapping it, you can just throw this out.
你可以掉嗰個嘢。
And we'll provide you with another one of these.
咁擺個身喺佢頭度，好似而家咁做。
You're going to wrap it just like it was wrapped before.
你又照做好似以前咁。
Start at the front and wrap around.
你擺喺前面咁，你喺後邊咁做。
Being careful not to put too much pressure.
唔好擺咁低啊！
Now it's already measured, so just keep wrapping until it's all gone.
佢哋已經同你剪咗，所以你就咁做冇晒得噶啦。
And when you get to the end, you're going to tuck it back in just like it was before.
如果冇晒咁，你就咁擺落去得噶啦。
Are there any questions?
你有冇嘢你想問佢啊？
Nope.
They have no questions for you.
Okay.
Okay, so the dressing change is done. Now it says that you want to use a Z-track method for the iron dextran she's supposed to get.
Yes. All right, in your chart it says that the previous nurse showed you how to do the Z-track.
係咪以前有個護士同你做咗？係。
Do you remember how to do that?
係。你識點樣做？
All right. I'm going to have you show me how you think you do that. Let's do it right on her arm.
佢想而家你睇佢點樣做啊？
Yeah, good.
佢識做啊。Yep, they know how.
Okay. Well, do they have any other questions for me?
你使唔使問你個護士第啲嘢？你明唔明晒做晒啲嘢啊？
Nope.
Yep, okay. It says that they understand everything and they pretty much have all the things that we just explained to her in the discharge.
Hello, Trang. Now we sent your mom to go get the car.
嗱，我而家擺你個凳度啊。
We're going to get you out of here. Can you please stand up and we're going to help you get into the chair.
佢而家擺你呢度啊。
Alright, now remember, since you just had a baby,
嗱，你而家係有個 BB 啊嘛。
be careful. Don't sit down when you hold him. And if you get sore when you're laying down, just put a pillow behind your back.
你知唔知如果你有個 BB 咁坐喺度咁好啲啊？ 如果你擺個枕頭喺度，咁唔會咁痛喺度，所以你可以坐喺度同